This is video 1 of the fibromyalgia series. Discovery that you have fibromyalgia can be a long-standing process. It took me approximately a year and a half following a motor vehicle accident and the shingles, repeated shingles that I contracted, and much long-standing suffering to determine that fibromyalgia was my issue. So what I put together is a video for you of some of the symptoms, not all inclusive, but some of the symptoms that I experienced to assist you in perhaps guiding you to the fact that fibromyalgia might be your issue. If you have fibromyalgia, one of the following or two of the following is more likely to be true. You have a long-standing feeling of not feeling well but not being able to put your finger on it. You may have frequented the doctors and wondered if you had a virus or something else and started to check on your blood work. However, all of your blood work may be coming back normal, and in the interim you still continue to feel unwell. As well, you may have had previous issues in the past with IBS, although your IBS may not be a current issue that you're having difficulty with. In other words, many fibromyalgia sufferers have had IBS issues in the past and continue to have IBS or sensitivity to particular foods. The third and final one that seems to be more commonly noted in the literature is that fibromyalgia sufferers have been subject to physical or emotional trauma. This, in my case, was a motor vehicle accident, and previously one could suggest that there may have been other significant losses and or emotional trauma that you may have suffered in prior years. In other words, this could start many years prior with pins and needles or some other simple symptoms that following consistent trauma, physical and or emotional, might result in the symptoms increasing in severity. This is still a big unknown. However, you can look to some of the literature and rheumatology information that's available in the reputable websites. A number of different symptoms could persist and they could come and go. These are some of the symptoms that I experienced, and extreme chronic fatigue is the one that was earlier on predominantly my issue. As well as symptoms start to develop, there could be something that happens as a result of treatment you're receiving, or you could have stiffness that graduates into the hands and you're unable to twist jars. You could have difficulty walking with stiffness and knee pain. And you may note that at certain times you have ringing in the ears. In my case, this happened morning, noon, and night that the ringing was consistent. You also could have light burning sensations, which over a period of time, a year or two, will continue to become more severe. These can be in the front of the thighs, the back of the thighs predominantly, the bottom of the legs. However, you could have them on one side of the body as well. A number of fibromyalgia sufferers have indicated that they could have pain on one side of the body, either the right side or the left side. In my case, the symptoms occurred predominantly on the right side, the right arm, the right abdomen, and the right side of the head. Pressure from the inside out in the same area where the shingles symptoms persisted and pins and needles were initially there. So any of these symptoms may be yours. This is not an all-encompassing list, but it is a number of symptoms that have been described by fibromyalgia sufferers. In terms of diagnostic tools, the medical community is limited. In other words, blood work may be coming back normally, your Rh factors, and all other blood work in terms of white blood cells and the number of tests that you've had may be coming back normal consistently. However, you still continue to feel ill and are not recovering. Once you do find a rheumatologist or a physiatrist, you may find that an evaluation of trigger points is the area that's focused on and a subjective description of your consistent pain. In terms of diagnosis, most commonly, rheumatologists are the area of expertise and physiatrists are the most familiar with this syndrome. It's described as a pain syndrome, and at this stage, there is very little known about the causes and also the treatment. A third option might be working with a naturopath and focusing on your IBS, as we'll come to talk about in future series, or experienced herbalists that can provide some assistance